We're speaking with the South Australian Health Minister Chris Picton. Chris, thanks for ringing in.
No worries.
We've got these claims made by the opposition. In effect, if I can paraphrase, they're saying that ramping is a lot worse than it was when the Liberals left office. Is that the truth?
Well, the truth is that we inherited an absolute crisis in our hospital system, and we're investing as fast as we possibly can in resources, in money, in doctors, nurses, paramedics to address the situation. But it's always going to take time to fix. The figures that they're using are completely bogus in that they're pointing towards a time in February 2022 when they had cancelled elective surgery. Of course, if you cancel elective surgery, then you are going to reduce pressure on emergency departments because there's a whole lot of work that the hospitals normally do that is cancelled. But that's not a sustainable way of operating, to cancel people's elective surgery, because it just means that down the track we have a bigger problem to fix later on. So we don't want to be going down the path that the Liberal Party did in cancelling elective surgery. And what is very clear is straight after they lifted that ban back over a year ago now, the ramping situation got worse immediately again. So they're cherry-picking figures on that elective surgery ban time that they introduced. They're not serious about putting in place any policies in this regard. They've got no suggestions, nothing constructive to offer, whereas we've got a comprehensive program, $2.4 billion of investment happening, hiring additional doctors and nurses, building more hospital beds where it's needed across the system. Because the issue that we have with ramping is because people are getting stuck in emergency departments waiting for beds in the rest of the hospital system.
Well, they've pointed
That's what leads to the ramping happening. That's why we need hundreds of extra hospital beds across the system. We're building them as fast as we can. We're hiring the additional doctors and nurses to do that as well. But obviously that takes time to do and to turn around that situation where ramping had got so chronic under their watch.
Well, those wait times to see a specialist that were referred to, I think, in the Sunday Mail, are they a legacy also of the decisions that you're talking about that the Liberals made in office?
Well, exactly right. When you've got a situation where, we were promised before the borders opened that the hospital system was prepared, but then the borders opened that wasn't prepared, and then suddenly elective surgeries and outpatient appointments had to be cancelled across the board, well, that has a legacy. The good news is that we're now improving the situation, and when you look at the outpatient waiting times, we're actually seeing more clinics across the board with improvements than ones that have got longer over the past 6 months that we've been in office, up until those figures were September last year that have been reported. And so that's very positive. And there's areas where, take neurosurgery, at the Royal Adelaide Hospital, that's gone from 60 months maximum waiting time down to 6 months. Or take oncology at Flinders Medical Centre. So these are cancer patients. The longest waiting time there got up to 41 months. That's down now to 4 months now. So there's still a long way to go. No one is saying that there isn't substantial challenges that we have to overcome in the system. We know we've still got a crisis happening in terms of primary care and GP access, which is impacting our hospitals as well. But we are investing as fast as we possibly can in improving the situation in our hospitals. That's our number one priority. And the Liberals have out there shouting about this, but they've actually got no constructive ideas or anything to put on the table other than saying we should be fixing their mess faster.
And just on you mentioned it's their mess, there was some bipartisanship about the handling of the COVID-19 situation at the time. To what extent is this solely in the Liberals' court as opposed to, well, this is a consequence of just getting the health system back up and running properly after the COVID measures?
Well, look, we were always consistent that we needed to invest in our healthcare system to make sure that we were prepared. And you look at, what happened over the past few years. We had things like the Wakefield Hospital was going to be reopened and used as a hospital to help care for COVID patients. And that was something that we absolutely supported. But then it was closed down before the borders opened. So that's not available for us to use. We are using every single possible bed that we have across the metro hospital system to care for people. We're using as many hospital beds as we can in regional areas and helping to support our metro hospitals with those beds as well. But the truth is that we need more beds, we need more capacity, and that's what we're working to do as quickly as possible.
Well, Minister Chris Picton, Health Minister in South Australia, thanks so much for calling in, helping to set the record straight.
Thanks, Ricky.